You're done.
Hello. I'm going to discuss a patient with chronic kidney disease. My patient was a 72-year-old Vietnamese female. She was married to a disabled war veteran. She lived in a one-bedroom apartment. Sister and brother lives locally and provide social support for her. She was diagnosed with chronic kidney disease 5 years ago, post-placement of a nephrostomy tube. She has strong cultural beliefs about her illness and uses herbal medicine. But she uses also traditional Vietnamese medicine, which follows the yin and the yang principle. She presented to the hospital with sepsis due to complicated UTI and lobar pneumonia. Medical history included chronic kidney disease, atrial fib, pulmonary hypertension, seizure disorder, major depression, paraplegia due to transverse myelopathy. Her medications include carvedilol, Dilantin, Coumadin, duloxetine, Norco, and albuterol. The husband had expressed that they are financially strapped and is worried that he might not be able to take her back home. Patient has HMO insurance managed by Healthcare Partners Medical Group. She's a full code, and she agreed to have all the necessary measures to keep her alive. The patient presented to hospital with lethargy, chills, and fever of 104 degrees. She was also tachycardic. Upon admission, she was found to have sepsis due to complicated UTI with renal calculi and lobar pneumonia. We did a CT scan of the abdomen, and it showed left-sided obstructive uropathy. Patient was given antibiotics for 10 days for the UTI and the pneumonia. Also, the nephrostomy tube was put in. It was intact after that. So that was something that needed to be monitored. Clinical judgment between self-care and treatment demands. Patient had some problems, language barrier, so she needed education to promote self-care and understand treatment demands. The goal was to maximize her independence and quality of life by promoting her ability for self-care. Also, really very important that she has to practice her personal autonomy to make self-directive choices. She needed to understand what's going on with treatment. She needed to understand the process of maintaining the nephrostomy, and she needed to understand all the different interventions that is being done. Barriers to self-care due to limited mobility. She was weak in the hospital, and because of the hospitalization, she wasn't able to do her ADLs. Risk also for inability for self-care during the hospital stay due to knowledge deficit on the nature of the course of the disease. So she didn't really understand what chronic kidney disease is because of the language barrier. She was in a lot of pain because of some stones that they found in her kidneys. Language barrier is a challenge in understanding the treatment plan. She had some emotional distress and anxiety about not being ready to go home. Psychological barriers also included depression and the uncertainty of a safe discharge, and emotional distress also because there's some family dynamics going on. Husband and the family are not getting along well. Priority patient issues for discharge planning would include the maintenance of the nephrostomy tube and monitoring output, knowledge on monitoring any signs and symptoms of infection. The patient did not really understand what to monitor, did not really understand what an infection is. So that was being explained to her. Compliance also with medications and follow-up appointments. We had to go over every single medications, what they're for, how many times she takes them in one day. That's the frequency, the dose, and all that. She was also explained about her follow-up appointments. She had a few of them with her primary physician for reconciliation of medications, urology appointment for her nephrostomy, and a follow-up to the Bridge Clinic. This is provided by the insurance company. Transportation issues also were discussed for her follow-up appointments, and also instructions were given regarding the coagulation clinic. And this is where she goes for her PT-INR testing. Discussion was also conducted about durable medical equipment, including hospital bed, wheelchair, and a nebulizer treatment machine. Assistance with meals was also discussed. Meals on Wheels was discussed as a resource from the community. And also home health services was discussed about what to expect with home health, with RN visits from rehab, occupational therapy, and physical therapy. So the priorities are to better her quality of life, safety, and stability of symptoms, and understanding the course of the disease and all the necessary interventions associated with it. Discharge planning. The discharge plan for the patient was to go home to the apartment with the husband. Home health services were to include the RN services. Like I said earlier, rehab would be involved. Physical therapist would be there to do an evaluation of safety. And occupational therapy would be there also to kind of help her with activities of daily living, bathing, grooming, hygiene, toileting, eating, and transfers. For physical therapy, they would provide strengthening of function, endurance, balance, gait training as part of the services. Follow up also with the primary physician for medication review. She went home with a lot of medications, including blood pressure medications, seizure medications, Coumadin, and pain medications, some narcotics. So that is really important in going through all those single medications and tell her the dose, the frequency when she's going to take them, and all that. There was also scheduled a follow-up with the Coumadin Clinic for coagulation related to her diagnosis of atrial fibrillation. Durable medical equipment includes hospital bed, wheelchair, nebulizer for home use. So the discharge plan was to go home with the husband, but the husband is unable to take care of her. She needed a lot of family support, and also included with home health would be the home health aide to just go and assist her with some of her activities of daily living. Next. So we're looking at nurse case management strategies on a patient level, on the system levels. And this would include the clinical aspect of it, partnership and empowerment, education and communication with the healthcare team. On the patient level, so it is important that we use this strategy because we need to do a clinical assessment of the patient health and monitoring of her physiological stability, especially and in this case for chronic kidney disease. So the patient has to demonstrate self-care and management to really understand what's going on with her and with that chronic illness of CKD. And we do this by partnership with the family, with the husband. Husband speaks well English. He understands the disease process, although sometimes he can be forgetful. So he needed also to be involved with encouraging the patient to self-care and manage the disease. Also encourage the family for support. They're at close proximity, so the patient is depending them also for moral support and social support. Education in disease management, monitoring for symptoms of infection, monitoring for output of the nephrostomy tube, maintenance of it, when to call the doctor. Those are all important clinical assessment that the patient needs to know. And communication with healthcare team regarding medication and treatments. So for the patient to be effective in self-care and disease management, the interdisciplinary team has to have these discussions with her and the family and the husband. At the system level, this is pertaining to access to healthcare. And this is her insurance benefits. She has healthcare plan as insurance. This is a managed care insurance. And she needed to understand how to avail of her benefits. So the case manager is very important in this aspect in providing education to her. She needed guidance in cost management and utilization management, home health services, like I said earlier. So at the system level, initially, utilization management comes in, determine medical necessity, gets verification of insurance eligibility, chooses an in-network physician. So in case, if you use an out-of-network physician, that's going to be more out-of-pocket expense for the patient. And also, we're talking more higher deductibles. Home health services, that would be a system that the patient would be familiar with. Communities, resources out there in the community. Home health services, like I discussed earlier about physical therapy, home health aid, RN, occupational therapy, and some community resources, Meals on Wheels, transportation agencies, access transportation. We've discussed that also as a means of transportation. Nurse case management interventions at the patient level. So we need to assess the patient clinical health needs to reduce exacerbation of the chronic kidney disease. We educate the patient on symptom management, monitoring for output in the nephrostomy tube, and providing coaching on the disease process and treatments. So basically giving her education on signs and symptoms of urinary tract infection. She went to the hospital for that, and also for respiratory signs and symptoms, because she also went to the hospital for the pneumonia. So we need to develop partnership with the family and family members, with the husband and family members, to empower the patient to do self-care, self-management of her chronic illness of CKD. Establish communication and therapeutic communication with the patient, family, and whole healthcare team to discuss different interventions and goals. Nurse case management interventions at the system level. Need to coordinate with the healthcare team, develop partnership to address patient needs and barriers to access healthcare. Utilize also managed care insurance to provide and avail of benefits, determine coverage, and at the same time reduce the costs. Have to assess financial problems as a cause of not obtaining high-tech medications, and also the much needed equipment when she goes home. Also needed to educate patient and home health services and community resources that are available out there. Utilization review. This is the part where the case manager reviews patient's medical record, including diagnosis and medications. Patient and family is not involved in this process. So we verify insurance coverage, we verify benefits and eligibility. Patient had healthcare plan, healthcare partners as her insurance plan. So care issues are determined of medical necessity, and care is rendered at the most appropriate level of care and setting. Whether the patient is staying inpatient in the hospital or at discharge, she could go to a skilled nursing facility or could even go home. So those are the different levels of care. Utilization review also includes selection of an in-network provider. This is critical because if you assign a patient to an outside provider, then that would increase the copayment of the patient and higher deductibles would be involved. And lastly, assessment of needs, the length of stay, and anticipated discharge. So those are all different items that are being discussed in the utilization review. There are some quality and safety issues that are involved with the patient. Number one is because she has a language barrier. Education is also a challenge due to literacy problems. Her highest level of education is high school. She never went to college. Also, her family husband belongs to a lower socioeconomic level. They're financially strapped. Husband receives fixed income from the government, but that's all they have to spend on a daily basis. Patient and family, also family dynamics. This was kind of challenge because the husband and the family members did not get along with. As far as treatment decisions, they were not on the same page. There was quite a bit of misunderstanding as far as what's best for the patient. Husband is disabled and unable to take care of the patient. There are some safety issues also because they're living in a cramped one-bedroom apartment. Nurse case management effective at the patient level. So we want to see if our strategies are effective at the patient level. So we look at the patient, we want to look at if the treatment goals were met in the hospitals, which was the case. She had no exacerbation of the CKD. The patient also verbalized understanding of the disease process, was able to demonstrate the skill of maintaining the nephrostomy tube. After several return demonstrations, she was able to do it. Also with the help of an interpreter, that was the reason why this was successful, because we had to get in the help of an interpreter and a family was there, coordinated, that way everybody was on the same page. The patient and family and healthcare team were working collaboratively to meet her needs and treatment goals. So because of all these coordination, communication was a lot better. So patient and family were very motivated. Nurse case management effective at the system level. The healthcare team was able to assess clinical needs and eliminate barriers to access healthcare needs. So at the system level, the case manager was able to verify her insurance eligibility and medical necessity. The patient understood home health services, availability of community resources, home health services were confirmed, and the nurse case manager discharge instructions regarding follow-ups were carried out, and the patient verbalized satisfaction and services rendered by her insurance health plan. So these are all my references for this presentation. Thank you, and I hope you enjoyed my presentation regarding my patient with the chronic illness of chronic kidney disease.